So in the last video we spoke about the steps to improve bone health. So today we will be talking about how to choose a milk. I am Dr. Ratnav Ratan, consultant Paediatrics Orthopaedics at CK Birla Hospital, Gurgaon. Now, choosing a proper milk product and milk for the kids may be sometimes difficult for a parent. We thought of simplifying it. So the most common dilemma is between skimmed milk or a full cream milk or a medium fat milk. So it's important that kids in growing years should ideally have a low fat skimmed milk because they have adequate amount of calcium in it. And kids who are in early, like the recommendation is less than 6 months of babies, they should be exclusively breastfed, so only breast milk in less than 6 months. By 1 year of age you can introduce cow milk. So the kids who can tolerate cow milk at 1 year should be given cow milk, because some of the kids who cannot tolerate usually have some of the other form of milk intolerance or lactose intolerance. So that needs to be taken care of when we introduce cow milk at 1 year of age. After 2 to 3 years of age, we can introduce buffalo milk, because buffalo milk is usually is higher, has a higher calcium content and has more calories in it. So, but they are more difficult to digest in younger kids. So we can introduce them after 3 months of age. So beyond a year, we can start introducing cow milk. After 2 to 3 years of age, we can start introducing buffalo milk, because buffalo milk usually has a higher calorie content and also has a higher calcium content. Now they are more fatty in comparison to the cow milk. Now if you see the chart here, it has higher fat content, but it also has double of calcium content and almost double of has a very high phosphorus content as well. So if the child can tolerate, we can always introduce it after 3 years of age. But most of these animal milk have they lack essential nutrients like iron, and they have no antibodies as in a breast milk. So less than 6 months of baby, we should not introduce these animal milk in any form, right? So we should also know how to choose the dairy products like paneer and all. We should need to learn to read the labels. We should understand how much of calories, what is the calorie content, what is the nutrition content, what is the protein content in every 100 gram of the product. So need to learn to read the food labels as given here. So if you try and choose a healthy milk supplement, like if you want to introduce a infant formula milk in kids who are intolerant to milk. So, and again, you need to choose an age appropriate infant formula milk, and need to study the labels and how much of different contents of different essential minerals and vitamins are there per 100 gram or per serving of the infant formula milk. So they are also recommended after 1 year of age if the child cannot take adequate milk or is not taking the mashed vegetables and the fruits. So they are also a good alternative to the diet if the child is unable to take. It's more important to choose them properly, learn to read the labels, choose them, avoid products which have trans fats in them and are having higher sugar content, so you can avoid them. Now if we talk about choosing the proper milk, especially the packaged milk, so again, among all the options, always confusing which milk to choose. Now it's important that we choose the milk with least amount of fat. So ideally if you choose a low fat milk with similar amount of calcium levels, so that will be better for the child and will give lesser calorie content to the child. So some of the milk products are also fortified with vitamin A and D, so you can always choose a fortified AD milk for the kids. And sometimes the child is lactose intolerant, has milk allergy, or the family is completely vegan, so you can always choose an almond milk with that. But then these are only for kids who cannot tolerate cow milk. They're good for weight maintenance, muscle gain, and it is sweeter in taste as well compared to the cow milk, but it's not a very good source of protein. So this is one of the options in kids who are vegan and lactose intolerant. Now again, soya milk ideally can also be used if the family is completely vegan and is also calcium rich, cholesterol free, has phytoestrogen, so they should ideally be avoided in young males and in teen males who are teens. They have been shown to have higher incidence of other disorders, so as far as possible this should not be a first choice of milk. So I think we have spoken enough about the milk. We now know what milk to choose and what to choose at what age. Thank you.